Hi, Dr. William Portuese in Seattle. Today we're talking about the combination of a rhinoplasty with a chin implant. Patient's biggest concern is usually related to how projecting or over-projecting their nose is. It's too prominent. And that's kind of the driver to come into the office to undergo a rhinoplasty. And that's fine. If the projection of the chin is fine, then all we're doing is reducing the overall projection of the nose with the rhinoplasty. But many patients come in, they have a recessive chin profile. And the recessive chin profile makes the nose look bigger than it really is. So the combination of a chin implant to augment the chin forward and the rhinoplasty to bring the nose backward is a very powerful combination. There's usually a large dorsal hump, so we come in and shave the hump down, perform osteotomies to narrow the nasal bones. We may or may not need to do some tip work, just depends on what's going on with it, if there's bulbous, boxy nasal tip cartilages. And we decrease the overall projection of the nose the best we can. But remember, the nose has to balance in all three dimensions, front, side, three-quarter, and then placement of a chin implant augments the chin forward. Again, the augmentation occurs mostly in the forward projection, but patients also get a little bit of lateral width and a very small amount of vertical height. So both procedures are performed in all three dimensions. The rhinoplasty and the chin implant procedures are performed under general anesthesia here in our Medicare certified outpatient surgery center. The anesthesiologists come over from Swedish Hospital across the street. They're all board certified physician anesthesiologists. If patients only want to do a chin implant alone, that can be performed under local anesthesia. But if we're doing both procedures together, they're both done under a general anesthetic. They can see the new chin immediately, and it's a pretty powerful combination. They know their chin already because there's no bandages on the chin. And they can kind of see the image of the nose through the cast, but as soon as we pull the cast off, and then they see the combination, of course they're both swollen, but they can see that combination, and they're usually extremely happy. The recovery for the nose involves placement of a cast across the bridge of the nose for a week, visible bruising and swelling underneath the eyes for usually about 2 weeks. The chin implant itself really doesn't have much bruising associated with it, but there is some swelling here, and the swelling subsides usually over the first several weeks. This patient has the classic over-projecting nose with a dorsal hump and an under-projecting chin. The under-projection of the chin makes that nose look larger and more projecting than it really is. So I did a closed rhinoplasty on her, shaved down the dorsal hump, adjusted her nasal tip cartilages, narrowed the bridge line a little bit, and then I added a chin implant to augment her chin forward so that it would balance from the side profile with respect to the overly projecting nose. The chin implant itself can accomplish projection of the chin more than I can reduce the overall projection of the nose backwards. So I can project the chin more based on putting an implant in than I can bring the nose back. Because if you bring the nose back too far, it won't balance in three dimensions. So she underwent a chin implant and a closed rhinoplasty for better facial balance and proportions.